This is a presentation on opioid use among veterans for the iReach program. iReach program is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by HRSA, HHS, or the U.S. government. This is a list of learning objectives for this presentation, including chronic opioid use and veterans, and prevention and treatment. Alright, let's get started. Opioid is an option for severe acute pain. Severe acute pain is the pain due to a known cause such as injury, surgery, and infection. If you take opioid as prescribed following doctor's recommendations, you could manage your pain safely and effectively. However, on the other hand, if you use opioid chronically, that could only lead to the opioid abuse without any analgesic effect but with various side effects and adverse effects. Chronic opioid use, which is known as opioid use disorder, is defined as opioid use lasting more than 90 days worth. Veterans are especially at high risk for developing opioid use disorder because of the chronic pain and chronic mental health issues. There's a number of symptoms derived from the chronic opioid use. Those include nausea, vomiting, dry mouth, sweating, constipation, and dizziness. Also, opioid-induced hyperalgesia is another major symptom, which is a paradoxical increase in pain despite taking opioids trying to control your pain. Other symptoms include negative affect, such as depression, anxiety, which lead to more mental disorder. Addiction, again, such as opioid abuse and opioid dependence. Falling asleep or losing consciousness. Failure to fulfill major obligations. Affecting brain that controls breathing that may cause slow, weak, or even no breathing. And finally, chronic opioid use even causes death. It is reported that 41 people died every day in the United States due to the chronic opioid use. Then how can we prevent the development of chronic opioid use? First, take the opioids as prescribed. Don't share your opioids with others. Here I put the link from CDC talking more about how to comply the opioid prescriptions. Second, try over-the-counter medication to manage your pain and avoid chronic opioid use, such as acetaminophen, ibuprofen, and naproxen. Third, try alternative non-pharmacologic pain treatments, including physical therapy, exercise, cognitive behavioral therapy, and pain neuroscience. Those are actually recommended to manage your pain. Patient education is also an important piece of managing pain in the same time preventing chronic opioid use. If you are knowledgeable about opioid use, chronic pain, and safer options to manage your pain, you can avoid the development of chronic opioid use. There are a number of good online resources to prevent chronic opioid use, including CDC online resources. So those are particularly about patient education, trying to prevent chronic opioid use. And also there's a list of frequently asked questions that should be helpful for the patient fighting with the chronic opioid use. With that, I'd like to conclude my presentation. Thank you for listening, and please also check other educational resources at iReach program, covering various topics related to veterans' health. Thank you.